Brain arteriovenous malformations are catching our attention this day because they can be solved by endovascular access, neuroradiology, and not making a huge craniotomy with a huge stress and a lot of trauma on the brain especially and on the bone. So endovascular access makes this less traumatic, less stress on patient, and a rapid recovery even in 1 or 2 days. Patient can go home and of course be happy of her or his life. So let's talk about brain arteriovenous malformations, or AVM. AVM represent a tangle of abnormal blood vessels connecting arteries and veins in the brain. The arteries are responsible, as you know, for taking oxygen and nutrients from the heart to the brain, and veins carrying oxygen depleted and metabolites back to the heart and lung. A brain arteriovenous malformations, or AVM, disrupts this vital process. An arteriovenous malformation can develop anywhere in the body, but occurs most often in the brain or spine. Even so, brain AVMs are rare and affect less than 1% of the population. The cause of AVMs is not clear. Most people are born with them, but they can occasionally form later in life. They are rarely passed down among families genetically. Some people with brain AVMs experience signs and symptoms such as headache and seizures. AVMs are commonly found after brain scan from another health issue, or after the blood vessel rupture and cause bleeding in the brain. Symptoms. A brain AVM may not cause any sign and symptoms until the AVM ruptures, resulting in bleeding in the brain. So, in about half of all brain AVMs, hemorrhage is the first sign. In people without hemorrhage, symptoms of a brain AVM may include seizures, headache or pain in one area of the head, muscle weakness or numbness in one part of the body. So they are light symptoms. In times that some people may experience more serious neurological symptoms depending on the location of the AVM, and including severe symptoms: severe headache, weakness, numbness, paralysis, vision loss, difficulty speaking, confusion or inability to understand others, and severe unsteadiness. Symptoms may begin at any age, but usually emerge between ages 10 to 40. Brain AVMs can damage brain tissue over time. The effects slowly build up and thus can cause symptoms in early adulthood. Once patient reaches middle age, however, brain AVMs tend to remain stable and are less likely to cause symptoms. Some pregnant women may have worsened symptoms due to change in blood volume and blood pressure. One severe type of brain AVM, called a vein of Galen defect, causes signs and symptoms that emerge soon or immediately after birth. The major blood vessel involved in this type of brain AVM can cause fluid to build up in the brain and the head to swell, so edema. Symptoms include swollen veins that are visible on the scalp, seizures, failure to thrive, and congestive heart failure. Risk factors. So anyone can be born with a brain AVM, but these factors may be a risk, like being a male and having a family history. So males are more commonly affected. How about family history or hereditary Cases of AVMs in families have been reported, but it's unclear if there is a certain genetic factor or factors or are only coincidental. So it's also possible to inherit other medical conditions that predispose patient to having vascular malformations such as AVMs. Complications. Here we counted a lot of complications. So let's start one by one. Bleeding in the brain. Bleeding in the brain. An AVM puts extreme pressure on the walls of the affected arteries and veins, causing them to become thin and weak. This may result in the AVM rupturing and bleeding into the brain, called hemorrhage. The risk of a brain AVM bleeding ranges around 2% each year. For example, if it is detected at 10 years old patient, 10 years old. So after 10 years, if patient have now 20 years old age, and each year add 2%, so if initially patient had 1% risk factor, now it will have 21% risk of bleeding. So the risk of the hemorrhage may be higher for certain types of AVMs, or if patient have experienced previously AVM ruptures. Some hemorrhages associated with AVMs go undetected because they cause no brain damage or no major brain damage or any symptoms, but potential life-threatening bleeding episodes may occur. Brain AVM account for about 2% of all hemorrhagic stroke each year and are often the cause of hemorrhage in children and young adults who experience brain hemorrhage. Another type of risks and complications are reduced oxygen to brain tissue with NAVM. Blood bypasses the network of capillaries and flows directly from arteries to veins. Blood rushes quickly through the altered path because it isn't slowed down by channels of smaller blood vessels. Surrounding brain tissue cannot easily absorb oxygen from the fast-flowing blood. Without enough oxygen, brain tissue weakens or may die off completely. This results in stroke-like symptoms such as difficulty speaking, weakness, numbness, vision loss, or severe unsteadiness. Another complication could be thin or weak blood vessels. So NAVM puts extreme pressure on the thin and weak walls of the blood vessels. A bulge in a blood vessel wall or aneurysm may develop and become susceptible to rupture, and of course increase in blood pressure. Another factor that add to the deformity of the vessel and formation of the aneurysm. Brain damage. As patient grows, body may recruit more arteries to supply blood to the fast-flowing AVM. As a result, some AVMs may get bigger and displace or compress portions of the brain. This may prevent protective fluids from flowing freely around the hemispheres of the brain. It's about cerebrospinal fluid. Diagnosis. To diagnose a brain AVM, a neurologist or neurosurgeon will review symptoms and conduct a physical examination. To diagnose malformations can be ordered one or more of the tests. Radiologists trained in brain neuroradiologists usually conduct imaging tests. Tests used to diagnose brain AVM include cerebral arteriography, computerized tomography scan, and magnetic resonance imaging. So cerebral arteriography or angiography also known as cerebral angiography, is the most detailed test to diagnose an AVM. The test reveals the location and characteristics of the feeding arteries and draining veins, which is critical to planning treatment. In this test is inserted a long thin tube called catheter into the artery in the groin and threads it to the brain using X-ray imaging as mapping or tracking. Dye is injected into the blood vessel of the brain to make them visible under X-ray imaging. Computerized tomography scan uses a series of X-rays to create a detailed cross-sectional image of the brain. Sometimes injected dye through an intravenous tube into a vein so that the arteries feeding the AVM and the veins draining can be viewed in a greater detail. And magnetic resonance imaging uses powerful magnets and radio waves, especially radio waves, to create detailed images of the brain. MRI is more sensitive than CT scan and can show more subtle changes in brain tissue associated with the brain AVM. MRI also provides information about the exact location of the malformation and any related bleeding in the brain, which is important for determining treatment options. Dye may also be injected to see the blood circulation in the brain. With cerebral angiography under X-ray, you can under X-ray see vessel and just imagine where it is located depending on the introduction of the tip of the catheter. In times that MRI shows you every structure by sections. And treatment. There are several potential treatment options for brain. The main goal of treatment is to prevent hemorrhage, but treatment to control seizures or other neurological complications also may be considered. To determine the most appropriate treatment for this condition, depending on age, health, size, and location of the abnormal blood vessel. Medication also may be used to treat symptoms such as headache or seizures, so pain medications. Surgery is the most common treatment. So surgical removal or resection. If the brain AVM has bled or is in an area that can easily be reached, surgical removal of the AVM via conventional brain surgery may be recommended. In this procedure, a neurosurgeon removes part of your skull temporarily to gain access to the AVM. With help of high-powered microscopes, the surgeon seals off the AVM with special clips. So applying clips and carefully removes it from surrounding brain tissue. The surgeon then reattaches the skull bone and closes the incision to the scalp. So resection is usually done when AVM can be removed with little risk of hemorrhage or seizures. AVMs that are in deep brain regions carry higher risk of complications. So a surgical removal by opening or open craniotomy is with more complications and traumatizing. In times at the end of vascular embolization, this procedure is with insertion of long thin tube catheter called into a leg artery and threads it through blood vessel to the brain, using X-ray imaging and tracking the catheter tip. The catheter is positioned in one of the feeding arteries of the AVM and injects an embolizing agent, such as small particles, a glue-like substance, microcoils, or other materials, to block the artery and reduce blood flow into the AVM completely. And the vascular embolization is less invasive than traditional surgery or open craniotomy. It may be performed alone, but is frequently used prior to other surgical treatments to make the procedure safer by reducing the size of the AVM or the likelihood of bleeding. In some large brain AVMs, Endovascular embolizations may be used to reduce stroke-like symptoms by redirecting blood back to normal brain tissue. And stereotactic radiosurgery, this treatment uses precisely focused radiation to destroy the AVM. It is not surgery, it is a literal sense because there is no incision. Instead, stereotactic radiosurgery directs many highly targeted radiation beams to the AVM to damage the blood vessel and cause scarring. The scarred AVM blood vessels then slowly clot off in 1 to 3 years following treatment. This treatment is most appropriate for small AVMs that are difficult to remove with conventional surgery and for those that haven't caused a life-threatening hemorrhage. But the last line to add, I can say that endovascular embolization is prioritized in these days and have a big success by insertion of onyx or other embolizing substances or glue-like substances or coils and making embolization of the vessel with a great success, and patient can go home in 1 day or 2 days after the procedure. Thank you very much and have a good time.